Hi, Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. In today's video, I'm going to go over 5 signs that you're dealing with a pinched nerve in your neck. The first sign that you're dealing with a pinched nerve in your neck is you have sharp pain that causes spasms in your neck and may cause your neck to lock up, and so you won't be able to turn your head left and right. That's the first sign that you're possibly dealing with a pinched nerve in your neck. The second sign that you're dealing with a pinched nerve in your neck is you're going to get shoulder blade pain right along this scapular border right here. So from the neck, then one of the nerves travels down and goes down the arm, supplies your hand, and a branch of that nerve goes right along the border of your scapula, your shoulder blade right here. And what will happen is it'll cause a pain. It'll almost feel like a knot right in that area, but often that is an irritated nerve, and that's causing everything to get knotted up around that area. So it's probably more of a pinched nerve that's actually coming from this area, even though you're feeling the discomfort right in this area. This may or may not be in conjunction with neck pain, shoulder pain that's radiating down. Some patients just have pain right in that area there. So that's the second sign that you're dealing with a pinched nerve in your neck. The third sign that you're dealing with a pinched nerve in your neck is you're going to get pain that comes from the neck and it radiates into your shoulder and often down your arm. A lot of times patients will have pain, they'll say in general it hurts right along that shoulder instead of a specific spot. So that's an indication that you're dealing with a pinched nerve in your neck. And it can also radiate down the arm and into the forearm and even hand. So that's the third sign that you're dealing with a pinched nerve in your neck. The fourth sign that you're dealing with a pinched nerve in your neck is you're going to get numbness and tingling in your fingers. It may just be your index and thumb, or it may be your 4th and 5th digit where you're getting numbness and tingling. Different nerves supply different parts of the fingers and hands. So for example, one nerve supplies the 5th and 4th digit, and then there's another nerve that supplies your thumb and index finger. And there's another nerve that supplies your back of your hand there. So depending on which nerve is affected, you may experience one or all of these, just depending on what's going on. But to test that, what we would do in the office is we use a device called a pinwheel, and we run this pinwheel over the fingers. And we compare that to the right and the left side, and if a patient feels either not enough sensation, or it's very dull, or if it's really hypersensitive and it's really painful, it's an indication that nerve is being affected, and that's the fourth sign that you're dealing with a pinched nerve in your neck. The fifth sign that you're dealing with a pinched nerve in your neck is you're going to get weakness in your hand. So you may notice opening jars or lifting coffee mugs, something simple like that is not as strong or as sturdy on that side. You may even drop something because you thought you had a good grip on it. And that's a sign that that nerve is irritated and it's coming from the neck and supplying your hand. And so that's what's causing that weakness. Once we take away that irritation, that strength and the numbness and tingling goes away. So that's the fifth sign that you're dealing with a pinched nerve in your neck. If you are experiencing any of these signs or symptoms, give us a call at 703-912-7822, or you can schedule online at novachirowellness.com.